Bonjour tout le monde. Alors, je me présente. Je suis Mélanie Robitaille, naturopathe, et je travaille avec les informations que Medical Medium partage. Aujourd'hui, j'ai le privilège d'interviewer Dr. Joy Clark. Alors, Dr. Clark est une obstétricienne, gynécologue et aussi psychiatre. Elle applique les informations de Medical Medium. L'entrevue va être en anglais, mais je vous encourage à activer dans le bas de la vidéo les sous-titres en français en espérant que mon anglais va être suffisant pour pouvoir avoir une bonne traduction francophone, mais c'est quelque chose qui est possible pour vous. Donc, sans plus attendre, j'aimerais vous présenter Dr. Joy Clark. Alors, hi, Dr. Clark.
Hello. Thank you
How
for
are you?
having me.
Oh, it's a privilege that you accept this interview. I'm very honored to that you will spend some of your precious time to share tips and your experiences and everything, because you are a medical doctor and you also apply medical medium information protocols. So it's a wealth of experience that we have with you. So, Dr. Joy Clark is an OBGYN and she also is a psychiatrist. She works in hospitals and it's in sessions. She works with people all over the world. She has so much experience. So, is there anything else that you will add, that you would like to add about all the great experience you've accumulated up until now?
Well, yes, there's all of the hospital training, all of the hospital work, including emergency room, because both OBGYN and psychiatry have a role in emergency settings. In
Mm.
addition, private practice in New York City, and I work on consults all over the world with people who need my services.
Mm. So you work with like an internet session like Zoom or things like that?
Yes, correct. Yeah.
That's
That's
great.
the wonders of the 21st century where we have a virtual office.
Yes, yes. And I've referred clients to Dr. Clark, and we'll talk about it later in this interview because she's such a compassionate and amazing doctor. So, Dr. Clark, can you share what brought you to the information of medical medium? How did you find his information?
Well, a family member recommended it to me. I wish I could have found it years earlier because for myself, in particular, I was suffering terribly from a chronic neurological pain syndrome called trigeminal neuralgia, which is chronic persistent facial pain, which is debilitating. And I had to limit the amount of time I could spend working because the majority of my time was dealing with pain, trying to get enough pain relief, trying to get enough sleep, reducing stress. It was a terrible situation. And even though I'm in the medical profession, surrounded by other professionals, no answers were given to me on what was the cause of what was the root cause of why I was sick. And without that knowledge, what could I do? What could I do other than continue on this path of taking medication or undergoing radiation treatments or surgeries, invasive surgeries to try to control the pain, all done without knowing what was actually causing my pain. So, as you can imagine, as soon as I saw this information, I latched onto it very quickly and never turned back. There was never a doubt in my mind. When when you are that sick with pain, all the, waffling, all the doubt goes out the door. You're like, okay, this says my problem is caused by a viral inflammation as well as toxins and heavy metal exposure. So what do I do about it? Oh, look, the book tells me what I can do about it. And I jumped in from day one. In fact, when the family member mentioned the book and I just looked it up on the internet, it was already evening and I couldn't stop reading. I mean, I went to the website. I was like, oh, there's books. Went to Amazon, ordered all the books immediately, and was up half the night reading. And not only that, because of the kind of person I am, I started contacting patients.
Uh,
Did you ever were you ever told you had Epstein-Barr virus? Oh, yes. Oh, yes. And I was like, okay, you need to read this book. I just found this information. So, I'm a healer at heart. So as soon as I had the information, within an hour, I was contacting patients to try to
Wow.
find more information and try to inspire them. Look, I'm going to start this immediately. Why don't you get these books? Why don't you start this? So, I mean, my only regret is not having access to it earlier. I could have done so much more earlier to help myself heal and help family members as well as my patients.
Hmm. When did you find his information? In what year? In what year?
It was late 2019. So I think it was right after Thanksgiving in 2019. So I always look at the American Thanksgiving each year as my anniversary. So I am almost 4.5 years into this journey, and have been healing quicker and quicker every month now, which is very exciting.
Wow, that's good. So you've tried a lot of medical treatments that were offered that are more well known by the public. So you've tried almost all of them?
I pretty much tried all of them, and that includes, because as you introduced me, I have two medical professions. And the reason I have the second is because I was too ill to stay in the first. And that was, one of the big, very sad moments in my life, having to give up a profession, or thought I had given it up, because now it's coming back because people actually have a lot of need for consults in obstetrics and gynecology. But back then I was giving up a surgical practice because I was just too ill to work. And I had zero stress tolerance, which, as we know now from the information in the books and the podcast, is the effect of stress on lowering our immune system and making all of our chronic situations much, much worse. So I had continuing in a surgical profession was out of the question, because my body could not handle the stress. I had to find an area to continue to work in where I could be of a minimal stress and set my own hours, which was very important. So yes, the pain actually started when I started medical school, which was a terrible time to come down with such severe pain. And for more than a year, but a year and a half into medical school, I had no diagnosis at all. They were treating me as if I couldn't handle the stress. Like there was something wrong with me, that I couldn't handle the stress that everyone else could handle. I just didn't have any way of describing to people how severe the pain was that I was describing. And remember, I was only 22 years old, so I looked young and healthy. You cannot see someone's pain. You might be able to see that someone's stressed, but you can't see the amount of pain that they're in. So, I made it through until, at a point, a dentist actually figured out that no, this is pain far beyond anything caused by dentistry. I'm going to refer you to a neurologist. And the neurologist said, well, what we're going to do is try a medication. And if it works, that will actually tell us the diagnosis. And sure enough, the medication worked. And I was like, oh, hallelujah. Hallelujah. For the first time in a year and a half, I had pain relief.
That's so amazing what you're sharing, because it includes I mean, people that are hearing that information that you're sharing, that you were being labeled, that you kind of correct me if I'm expressing myself not in a good way, that you were labeled not handling the stress in a good way.
Right. That there was something wrong with me, that I couldn't handle the stress. And well, I mean, gosh, this was 38 years ago. So probably the viral strain that was causing this degree of pain was probably fairly new on the planet at that time. And so they didn't even have a lot of experience with people coming in with this kind of pain. So when it was starting to appear, they were like, never heard of it, right? What I was told when I was finally diagnosed is like, oh, this is an illness that only old people get.
Hmm.
And you're 22. So why would you have this? So, I mean, they were completely clueless as to why a person, any person, whatever age, would have pain that severe.
Thank you for sharing because it includes, I hope, if people that are in severe pain can have hope. As you started your healing process in 2019, so it's 5 years ago, and you've, as you said, you healed so much, and I'm sure there's symptoms that are completely gone, completely healed. So it was for a lot of years that your body had to deal with that virus that was damaging your nervous system and the trigeminal nerves and all of that. Oh, so that's so I hope if anyone, feels, why do I have pain? There's hope. And also it's sad that we're labeled that it's kind of a way to handle life or the way of thinking or the way of dealing with life, which is not at all.
Yeah.
Mm.
Yeah. And I mean, facial pain is known as the suicide pain because the pain is so severe. It's beyond description. If you haven't felt the pain, it's very hard for someone who has the pain to describe what it would be like, because when the pain is in your face, you can't talk. Sometimes you can't, it's painful to talk. You can't eat, right? You're limited to a liquid diet. You can't sleep because the pain keeps you up at night. And if you can't sleep, you can't heal. It's really a nightmare.
Mm.
I know there are so many people out there now still experiencing this kind of pain, and my heart goes out to them because I hope that they, like me, find their way to this information and know that there is a path to heal.
Yes. Was that causing pain also, if I may ask, because you talked about dentistry, like the dentist that diagnose you, that puts you on the path of the pain and not causing, not the way you handle the stress was not at all a cause, but was it also going through your gums and teeth, or it was
Well, once someone actually saw me in an episode of pain, it was easier to diagnose because it was so beyond ordinary dental pain. Because like the slightest touch of my whole face would be just, the pain would shoot everywhere, shoot up towards my nose, my eyes, towards my ear. It was unbelievable. And it was electric bolts of pain. And this is not typical to dentistry. Now, not everyone who presents with facial pain has that classic electric bolt type pain. Some have localized pain that stays, particularly in the molar regions. And they very often end up with a lot of dental procedures because the dentist assumes that it's the root of the tooth, and they get root canals quite frequently. But my pain wasn't localized to teeth. It was shooting, it might start in the lip area or the tooth area, but it would shoot like electric bolts. Yeah.
okay. Okay, thank you so much. So that, and I'm so sorry you went through that. It's um, the pain is something debilitating that I go with when I have clients that consult with pain. Sometimes it's like they cannot have a life. It's as you said, you had to change profession. So and that made you add another degree, another doctor
Yeah.
degree, and now you have the degree of being a psychiatrist. And
Right.
does that modify those information from medical medium, the way you work with your clients, your patients in psychiatry?
Could you clarify a little bit how you mean?
Yes. Does that the way the psychiatry field work, because of your experience with medical medium protocols and information, and maybe especially from the last two books, Brain Saver, do you have a different approach? Like, would you share other information to your clients, as you already share that 1 hour after discovering medical medium, you were calling clients, but do you have a certain vision that change with your client that are especially in psychiatry?
Once I found the information?
Yes.
Oh, absolutely. I know, because having, been in different hospital trainings, different emergency room settings, different focuses within medicine, that how little we actually know. And we and this is a medical doctor telling you this, how little we actually know. And as we read, the brain saver, we learn that that is actually by design, that those who with the most training, the true knowledge of why people are sick is actually being withheld from even those going through this very expensive training that we are paying for. We are not being told the root cause of illness. And there's a lot of profit to be made within the profession from sick people. And
Mm,
so you have to question whether the system actually wants sick people to get better,
mm, mm.
right?
Yes.
That they talk about disease management rather than disease cure, right? No one
Yes.
talks about cure. We talk about management, right? And so there's an assumption within medicine that your illness can be managed, but we never promise cure, because how can you cure when you don't know what the root cause of the illness is? All you can do is manage. And so it's changed my perspective in both specialties. It's like, okay, let's look at the root cause of your illness
Yes. Instead of managing symptoms.
instead of managing symptoms, which is how the profession is set up.
I love it. I love it when you say it's not managing the symptom, like that's the setup right now, but now it's going to the root cause. With the medical medium information that you do apply, so that changed all the vision of people that label themselves or being labeled with different behavior or things like that, and then to know that it can be cured. Like sometimes for myself, I know that there was some kind of, some little obsession, of doing some things. And before I was like, judging myself, and now I see, okay, no, it's heavy metal, just continue digging, removing the heavy metals, and yes, there is less obsession. so
That's right. Yes.
so it brings me to have more compassion and more understanding and knowing the real cause, instead of trying to process something or label myself with something. So, and can you share the top 3 things that helped you the most from what you discovered in the medical medium protocols?
Well, definitely the morning routine, which is, classic in the medical medium community. Our morning routine consists of lemon water upon awakening for the hydration and the flushing out of what the liver had packaged up and gotten ready for release during the nighttime, followed by our, either 16 or 32 ounces of celery juice for all the miracles that celery juice can do for our system, followed by the heavy metal detox smoothie as our breakfast, which is completes the morning routine in flushing out toxins, breaking them up, locating them, and removing them, chelating them, and removing them with the ingredients in the heavy metal detox smoothie. I would say that's would be number one on my list is the morning routine.
Okay.
Number 2 on my list would be hydration, 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 because hydration can't be just in the morning. It has to be all day long. And thinking more of raw fruits and vegetables. So it means that's the unprocessed foods that we eat, right? Our salads, our fruits, our apples, our bananas. And then with those, saving any possible dietary fat that we might want to eat that day for our last meal of the day or our last snack of the day, if that is part of something that you desire for that day. So the diet would be the number two. That I recommend is trying to stay with the fruits and the vegetables for 2/3 of the day, if not 3/4 of the day, and then saving your cooked food for dinner and any fat that you might want to have that day for the dinner time or the post-dinner time. And then I think that the third element would be the supplements, actually treating the root cause of what's been making us ill with the supplements. The foods, of course, are also very healing, but the supplements really take it to the next level because we have a whole array of supplements through the medical medium books that can target specific ailments, particularly the viruses.
Yes, yes. Oh, yes, thank you. Yes, so amazing. So the morning cleanse, hydration with a lot of raw fruits and vegetables, and the good use of supplements. So, and that brings me to my last question is about medication, because we were talking about supplements as your top three recommendation, what helped you the most. And I want to talk about medication. I had the chance to be around you and see you coaching people that sometimes want to stop their medication too fast or don't understand the side effects of their medication, different things. And it's a field that it's not my field. And by the way, I didn't express the disclosure, but here it's an interview that I do with the generosity of Dr. Clark. And it's not a diagnosis or it's not a suggestion to modify or stop your medication, even though we talk about medication because that's the area that Dr. Clark is being allowed and working with also. So, so to come back to my question, sometimes I have clients that wants to remove their medication very fast, and I say no. I refer them to you because you are such a compassionate doctor, and you give them a right path to do it in a good way. And if there's anything you would like to share about that, because to understand the effect of medication is very important. And I have to say that some of my clients have not been explained how the medication they've been prescribed, how it affect their bodies. So is there anything you would like to say about medication? And by the way, I never say to modify or to diminish or stop medication. It always have to be done in a correct way with your doctor. But I would like to have your input on weaning medication, and because all medication have side effects.
Right. Yes, all medications have side effects. And originally, medications were suggested for short-term usage, but there has been a trend in medicine clearly going on for years now to keep people on medications long-term. And that makes sense when you don't know why the person is sick. You assume that if they've seen some improvement, however slight, on this medication, then you would want them to continue it so that they don't get worse. Well, that's the rationale. But we also have to take into consideration the long-term effects on that person's body of being on medication far longer than it was ever originally intended to be used. But unfortunately, that's the situation we're seeing in medicine, is people on medications long term with no plan for eventual discontinuation. So when I evaluate someone who has been on medication, first I want to have a clarity of the diagnosis for which they were treated. Because very often I'm finding that the diagnosis was set with very subjective information, and it was a decision the doctor made based on limited information. And I've seen many times when the diagnosis actually is not correct. And so now you're treating a condition, a label that wasn't actually correct in the first place. That there, especially within psychiatry, we're seeing overdiagnosis.
Okay.
Yeah.
Okay.
And then when what another problem I'm seeing a lot with psychiatry on my consults is polypharmacy, where one medication wasn't good enough, so another was added. And then two medications weren't quite enough, and so a third was added. And then very often we even see a fourth that was added just to control side effects from the first 1, 2, or 3 medications. So now we're looking at a complex medication regimen.
Hmm.
So if one medication has side effects, can you imagine what 3 or 4 taken together would have?
Hmm. Hmm.
And so those are going to have more serious long-term complications than even a single medication. And then what if those 4 medications were being prescribed for someone, and yet the original diagnosis is still suspect?
Oh,
Yeah. So you can see the situation that we often encounter in psychiatry. And fortunately, we have a completely different approach that is much kinder on the person's overall well-being. Now, if someone came in to you and they were on 4 medications but decided, look, I've had it with this, I'm gonna stop them all, and I'm going to, do it all with fruits and vegetables. With you as a practitioner, your eyes would be like, whoa, that's 4 medications.
yeah.
No, wait, slow down.
Yes, yes.
Because you need to, you definitely need a physician's evaluation at that point, and that there needs to be, a plan put in place on which medication may be, the least effective, and maybe we could address that medication first, and we could start a small reduction on that medication with a plan to reduce further as you're tolerating it. But never would we consider, even if you were on 4 medications, to just stop the 4th one added. Even that would be the wrong approach. Things have to be done a little bit more carefully than that.
Yes. To do it with Dr. Clark. I will put her information down in this video, and you can work with her. I love it, the way you work with people and the way you explain everything. I've witnessed that, and that was amazing. So yeah, so that's very important, because I know more than half of my clients have a combination of multiple medication. It's more common now than before, I feel.
Yes, I think it has significantly increased over the years that I've been in practice, that polypharmacy became the norm, unfortunately.
Okay, okay. So, and so we'll conclude this interview. So, is there any other conclusion or things that you would like to share about your healing journey, or about your journey with discovering medical medium information?
Well, I would just say the books are amazing, and we have 8 of them now to reference, and every time you open the books, you learn something new. Even I'm telling you, myself, with, medical degree and 2 specialties, I learn more every time I open the book and spend an hour reading. They're just amazing, and I highly recommend the books to everyone, to go back to the source and know where all this information that you and I have been talking about actually comes from. And every home should have the full set of books as references in their home.
Oh, yes, yes. It's the best conclusion. Yes, because it's the source of all the information that I use when I work with clients, and as you shared yourself also. And it's the best. Yeah, it's so amazing. I've thrown away all my other books on health. I don't need them anymore, and there's so much distraction. I mean, there's lies, there's information that are really so not founded and not correct. So whatever, if it's in the natural health or conventional health. So thank you so much, Dr. Clark, and I really appreciate you as a human being. I've had the chance to be with you in some training, and it's a privilege to refer you clients and that they can see you. You speak a very an English that French Canadian people or French from France they can understand because it's very clear. So I encourage you so much, everyone, to have a session with Dr. Clark. If you know, she will provide with a very amazing information and compassion.
Thank you.
Thank you. Bye bye.